Real world experience is very valuable to academia. I think when you are a professor that has world experience, it changes the level or the intensity of your lectures because you're able to add that lived experience and give students tangible examples that they can work with to understand the concepts. It's also important to note that textbook doesn't cleanly translate to action, right? So just because we learn something a specific way in a textbook as a practitioner, we know that it requires some level of adaptation contingent upon the environment upon which you're trying to apply that knowledge. And so as a practitioner that has both, I think that it adds value to academia because we're able to get students to think outside of the box or to think outside of the textbook.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Hey friends, welcome to Public Health Careers. I really enjoyed chopping it up with Quinyatta today. You'll learn a lot of great insights, and some of the things that you'll hear more about today is the importance of first disciplining and controlling one's mind to enjoy good health, to bring true happiness to one's family, and to bring peace to all. Understanding how academia and real-world practice can mutually benefit and contribute to advancements of public health and population health, learning about what it takes to be an MPH program director and what all that entails. You'll also learn about running a consultant company for the last 6 years while doing all the other great work that she's doing. If you enjoyed today's episode, all I ask is that you hit that subscribe button, leave a review, and share it with a friend. That really helps the show get out to more people. So be sure to subscribe, leave a review, and share it with a friend. Okay, enjoy the show.
Hey, this is Dr. Quinyatta Mumford, founder and CEO of Mumford Associates, a minority-owned public health consulting firm that aims to bridge the gap between lifestyle diagnosis. And you're listening to Public Health Careers.
Today we have someone that believes to enjoy good health, to bring true happiness to one's family, to bring peace to all. One must first discipline and control one's own mind. She conferred a Bachelor in Biology at the University of Alabama in Huntsville, then got her Master of Public Health in Community Health and Preventive Medicine at Walden University. She later got her Doctor of Public Health at the University of Arkansas of Medical Sciences. She currently works as Program Director and Assistant Professor at New York Institute of Technology, as well as is the Chief Executive Officer of Mumford Associates, and holds two adjunct professor positions at New York Institute of Technology and Southern Arkansas University. We have Dr. Quinyatta Mumford, DrPH, MPH, CHES. Welcome to the show.
Thank you very much. Thank you for having me.
It truly, truly is my pleasure. Looking forward to learning more about your journey and getting all the insights from that as well.
Okay.
So tell us, how do you identify, and tell us a little about your personal background?
All right. So I identify, my pronouns are she and her. I am a small business owner, a very active public health practitioner. I am also the mother of 3. And yeah.
In your intro, it talks about in order to get good health, to have true happiness, and to bring peace to all, we must first discipline and control our own mind. Can you talk more about the discipline and control of one's mind?
I think when we speak about the discipline and control of one's own mind, one of that is identifying and being confident with who you are as an individual, and then also realizing that there is no competition. You are your competition. I think a lot of times we lose sight of our own goals, our own vision, our own dreams because we get lost in the dreams of others. And so, in order for us to really have true happiness and true health, we have to focus on what's good for us, right? What's physically good for us. Just because someone else works out 3 times a week, it doesn't mean that that's what's physically good for me. And that if I have limitations or challenges that prevent me from doing that, I have to work within my own confounds of what my boundaries are and stop keeping sight on what other people's boundaries are.
I appreciate that, and I think that's a good framing and framework to think of things. Because many times we're like, "Oh, this is not for me," or they're doing this specific thing. But like to the point of health could look so different for so many different people, and there's so many ways to achieve good and optimal health. And just understanding that it doesn't have to look this specific way because you see like the social media influencer doing this one thing, but you just going out there and taking a leisurely walk, that is something that contributes to health. You creating space and time to have relationships with your family, that is tied to health. And just understanding that there's no one way to be healthy, but there are many different ways that you can effectively become healthy is I think important. So I appreciate you
Yes.
sharing that.
Yes. It's
And
definitely personal.
how so?
Personal in terms of identifying what works for you, and staying true to yourself. You have to have a realistic definition about health for yourself. For some people, health may be that I'm not on any medication. Health may be that I'm able to climb a mountain. So it varies from person to person. So it's really a matter of identifying what's important to you. For me, health includes having a healthy relationship with my family, making sure that I'm taking the appropriate steps so that I have good mental health as well as good physical health. Those things are equally important to me.
Yeah, couldn't say it better myself. And I think like to that point, just ensuring that you are not comparing yourself to others in your journey towards health, but just understanding that you can form your own definition and your own framing of what health is and doing the things that make you healthy. So I appreciate that. And
Yes.
in addition to your practical experience, which we'll talk about it later on in the interview, you hold a Doctor of Public Health degree and have been involved in academia as an adjunct professor. How do you believe academia and real world practice can mutually benefit and contribute to advancement of public health?
I think that real world experience is very valuable to academia. I think when you are a professor that has world experience, it changes the level or the intensity of your lectures because you're able to add that lived experience and give students tangible examples that they can work with to understand the concepts. It's also important to note that textbook doesn't cleanly translate to action, right? So just because we learn something a specific way in a textbook as a practitioner, we know that it requires some level of adaptation contingent upon the environment upon which you're trying to apply that knowledge. And so, as a practitioner that has both, I think that it adds value to academia because we're able to get students to think outside of the box or to think outside of the textbook.
And I think this is one of the reasons I kind of like the Doctor of Public Health over the PhD in Public Health is because it gives you taking that kind of like theory of what public health is and like whatever that issue is and really like developing you into the leader that can enact and practice that public health in real world
Mhm.
situations. But we'll talk more about that a little bit later on in the interview. So before we get into your collegiate career and your journey into undergrad, what does public health mean to you?
Public health, to me, so we're going to go with the commonality that we hear, and because it really resonates with me. Where you live, work, play, learn, worship, it impacts your health, right? So to me, public health is everything. It's everything that's around us because all of these things truly do impact our health. And so when I think about public health, it's ensuring that where we live, work, play, learn, and worship is a healthy environment for everyone.
Absolutely. Those are the factors that are what life is, and like how do we create a life that is supportive of our health in all those different domains, I think is important and is the viewpoint and perspective that public health really takes. And just wanted to clarify that before like I also believe that people with PhDs can be effective practitioners in the field. I just think it takes a little more intentionality in them doing that work. So just so I don't get any PhD haters out there.
Oh yeah, definitely no hate for the PhDers, man. Public health is interdisciplinary. It takes all of us. One of the greatest values I think that we each contribute to public health is our lived experience, because your lived experience is going to be able is going to foster an understanding from various lenses. So regardless of whether you hold a degree or not, your lived experience adds value when we're trying to move forward in public health, especially when we put it into the context of where you live, work, play, learn, and worship, because we know that there are complexities in all of those arenas that really is divided upon whether you have or have not. There are some factors that contribute to that is going to require influence from all levels of individuals.
So you got your Bachelors of Biology at the University of Alabama in Huntsville. Tell us about that thought process of going into undergrad.
All right, so going into undergrad, I knew I was going to be a doctor. Yes, I was going to be a doctor. I was going to be a doctor. I was going to school to be a doctor. And I got into organic chemistry and realized that medical school probably was not promised to me. And then I also realized that I really didn't like blood. And the concept of, as I started to move through my undergraduate journey, I started to come to the realization that there were some things that were happening personally within my own family that raised some concern for me. My great grandmother died from colon cancer. My grandmother died from colon cancer. My aunt died from colon cancer. And so I wanted to have a better understanding of what was contributing to this. And I knew that there had to be some underlying factors that warranted some exploration, which opened up my eyes to public health, to health education, and promotion, and kind of shifted to the trajectory of where I wanted to go.
You still became a doctor though, so
I
just
did. I did.
many paths to becoming a doctor, and
Oh, yeah.
uh, I feel like these are the two themes that I hear the most about people that are like biology majors wanting to become physicians. It's either like organic chemistry or the blood part of things. That's like, okay, this is not for me. What else can I do that's health related? So that definitely is a theme that comes
Yep.
up many times
Oh,
all the
yeah.
time.
It'll get you.
Right,
It'll
right.
get
But
you.
and I also appreciate, and I'm sorry for your loss and condolences to you and your family. But
Thank
once
you.
again, I think it's many times those experiences just open us our like eyes up to like what is possible in health and how can we impact health in different ways. And I'm glad that you're able to take those stories of those family members and really use that to go forward in your journey to do work that is going to help and prevent these types of things in the future for many populations.
Yes.
Yeah, the impact of public health.
Oh, yeah.
Right. So, were there any experiences during undergrad that you thought were very informative that you would like to share with us, or not so much?
Not so much. I really did not start to really dive into, other than my family history and becoming curious about what was happening with my own family. Also, growing up in a rural community and looking at some of the ailments that have happened to people that essentially, when you grow up in a small rural town, everybody's your family. So as you look at the dynamics of health around you, it just starts to pique your interest. However, it wasn't until I actually started into my master's journey that I really became intrigued about public health.
Understandable. And just before we get into that Masters of Public Health journey, were there any undergrad takeaways that you wanted to share with us?
Undergrad takeaways. The biggest thing that I learned in my undergrad careers is tenacity. Really to just keep pushing forward. And that was when I pivoted the first time in terms of, hey, this is where I thought I was going to go. I thought I was going to go to medical school. Learning how to be flexible and to not allow a change in course to distract you from moving forward. That's really when I started to say, I can push through anything and I can also recreate myself and my vision, and it'll be okay.
I appreciate that, and I think that is the journey of a public health person many times. It is like pivoting as you learn more things and as your journey develops to understand that there's just so many different things that you can
Mhm.
do and just figuring out like what is your path in making that impact around health. So you got your master's of public health in community health and prevention medicine at Walden University. What was the thought process going into there? Like, did you instantly learn about public health throughout your undergrad and then you're like, okay, I'm going to do this master's of public health, or what was that thought process like?
Honestly, this is gonna be interesting because the reason why I started pursuing a master's degree was because I was working 60 hours a week, 10 hours a day, 6 days a week on a chemical D-mill site. I was a chemical analyst, which meant that I spent a lot of time waiting for samples to come off of the machine. And I value my time. And about a year in, I was like, I can't keep doing this and just sitting here waiting for these samples. I've got to be doing something to advance myself, because I'm always forward thinking. Projects don't last forever. When this project ends, what do I want to do next? Well, this is actually why I ended up at Walden. Walden was one of the online MPH programs that would allow me to continue to work 60 hours a week, earning my keep, while also earning my degree. So that's how I ended up at Walden. Again, I always had that question in the back of my mind, like, why are my family members dying from colon cancer? Why am I seeing, my classmates develop breast cancer at early ages, and we all live in the community, right? What is it about our community that's making people sick? So that question was there. So when the opportunity came to pursue a master's degree that would not compromise my work schedule, but then would pique my interest enough to keep me engaged, it was a no-brainer for me to go ahead and pursue my master's degree.
Really just following that path of knowing that what you're doing in the 60 hours a week is not like really sustainable. So like what can you do additionally to build those skills while you do have the flexibility to do it? And I can imagine like that's the possibility of that online program and just how that was like so helpful in the week. And I guess the question that is kind of just in my head is, you're working 60 hours, you're doing this masters of public health online. How did you balance that, if that's the right word? How was that for you as an experience?
It was actually pretty cool because that meant that while I was working my 60 hours, whenever I was waiting on my samples to come off, I mean, that was dead time anyway, because I'm waiting for the machine to do what it needs to do. So I would go in, I'd put my samples on while they ran. I would read, I would do my discussion questions, I would do my assignments, write my papers. Whenever I had downtime on Sundays, because Sundays were our only off day, I would wrap up any work that I had for the week, which wasn't much because you're on site 10 hours a day, which affords you a lot of opportunity to get work done. For me, it felt like a better use of my time.
Were there any experiences during your masters of public health that really you wanted to share with us, or there were some key takeaways from that?
The key takeaways that I take away from the master's program is I'm originally from Alabama. I was working on a chemical D-mill project in Arkansas, in Pine Bluff, Arkansas. My neighbor across the hall from me, her father was actually an epidemiologist at the state health department. So part of the MPH program, most MPH programs require you to do a practicum. Well, I wasn't quite sure how I was going to do that. I connected with my neighbor's father. He put me in contact with the health department. They offered me a practicum, which introduced me to a population that blew my mind, and that was the Marshallese population. Before that, I knew absolutely nothing about the Marshallese, why they were in the United States, or the complexities of health that went along with that population. But it opened up my mind to really understanding the textbook when we talk about cultural sensitivity, when we talk about behavior change, when we take all of those theories and take it into consideration, and you actually have to apply it to people that think differently than what we think, that have cultural beliefs that are different from yourself. It really challenges you to be sensitive as you try to help them or support them in their health journey.
That's very important, and I think something that happens many times in public health is like we are doing work and then we find ourselves working alongside four communities that we don't really know too much about. And I think that's where the cultural intelligence, cultural humility, cultural understanding comes in, which is I think huge aspects of public health that people really need to take in. It's like, how can I approach this community to learn and to listen and to just really hear out what are their perceptions of health, what are the things that are challenging to them, and then from there really working with them to build solutions to address those health issues.
Excellent. Yep, that's true. And that's really when the rubber hits the road and you realize as a public health practitioner, we do things with people. We don't do things for people and we don't do things to people. We do it alongside of them.
Absolutely. And I'll go back to my I can't remember what I called it before, but it's like the golden statement of public health is like meet the community where they're at. And I
Meet the
think
community where they
that encapsulates all of what you're saying there. So that's very, very important. I believe it was after you graduated, you became a lead-based paint epidemiologist at the Arkansas Department of Health. So tell us about how do you come across that and what do you do in that position?
Well, at the time, the Department of Health had taken the lead poisoning prevention program from the Department of Environmental Quality to focus more on the health aspect of lead exposure, specifically as it relates to elevated blood lead levels in children. So I was the first epidemiologist in this program. One of the things that I quickly realized is that there was a disconnect between clinical diagnosis and actual lifestyle as it relates to lead exposure, specifically in children. Because yes, you have a treatment protocol clinically, but unless you remove the child from the source of exposure, they'll continue to present with clinical symptoms. And so it became a challenge to me to identify ways that we could better support our healthcare system. And so what I did was I became certified as a risk assessor, which allowed me to go into the homes and to essentially search out the source of exposure, send those samples off to the lab in hope of identifying the source of exposure so that we could then mitigate it. And so I created that program for the Department of Health where our epidemiologists would become certified as risk assessors and they could work with the physicians to coordinate care with the patient. Once we found out the source of exposure, we wrote a letter to the family, we wrote a letter to the physician, and we started to think about mitigation strategies.
That's important work, and I think like that goes back to one of the things that I feel like we think about a lot in early stage public health is like people go to the hospital because they have these symptoms or this disease, and then many times you like treat them for what the symptom is, but then you put them back in the same environment where they're gonna just get affected and impacted in the same way. So like to your point is it's a big challenge there. So what do I have to do to really understand what in their house is causing this and how can I work to mitigate it? And to your point, like how did you learn about the certification around being a risk assessor and doing that kind of work?
Well, of course, there's some rules and regulations that go along with lead abatement because we know that lead exposure is very dangerous. And learning about the rules and regulations that were associated with lead poisoning, that's how I became aware of the certification. So then I sought out a school that would allow us to come in and be certified. So essentially, it was the same certification that our contractors had. And as a public health practitioner, I think it's critical that we have that boots on the ground understanding of the people that are doing the work so that we can have better conversations with them. And so I went to school in St. Louis to get my certification and was able to bring that information back in order to build the program.
So really just doing the work, learning about it, and then from that learning that they are the certifications that you can do to like just increase the impact of your work and kind of try to treat this from a root cause perspective as opposed to just downstream, which I think is
Exactly.
also right. Very, very important. Okay, so you had a few other positions at at the Arkansas Department of Health. I will name them out for you, and then you could tell us about the different experiences and what you did in all of them. So you were a public health preparedness epidemiologist, then an enteric disease epidemiologist, then a COVID-19 epidemiologist, then the director at the Office of Rural Health and Primary Care.
Okay, awesome. So as a public health preparedness epidemiologist, I got an opportunity to work with FEMA. One of the things that I developed for the state was a certification program for closed pod dispensing. So essentially, if there's a mass need for medication across the state, there are some closed sites such as work sites or nursing homes that will dispense medication to the populations that they serve in order to keep their operations going. However, when I came on board, a lot of them didn't understand exactly what their roles and responsibilities were, and that timeliness was critical, even though they were only serving their population. So I developed a certification process to help them better understand and process. So it put the state in a better position in terms of readiness, being able to trust that those that were going to get medication to dispense in a closed pod were ready and able, because the state wouldn't be able to support them because they would be supporting the open pod sites. As the enteric disease epidemiologist, this was a great job. I got a lot of opportunity to work with our environmental inspectors. One of the things that we were able to do was introduce whole genome sequencing for food poisoning into the state, which kind of changed the way that we processed samples in the lab. So that was a very innovative opportunity. Shortly into my role as the enteric disease epidemiologist, COVID hit. And I got to be very active in the COVID response, including supporting the development of the case investigation and contact tracing protocols, including training our call centers, including our National Guard, and really helping to support the ins and outs of the overall COVID response in the state of Arkansas. After that, I was the director of the Office of Rural Health and Primary Care, where I really got to engage in programs like the J1 Visa program, and then also looking at some of our smaller providers and making sure that they had the resources that they need to keep going, especially during COVID. They needed a lot of assistance to ensure that we maximized on our access to care in our rural communities.
So a lot of different positions and a lot of different rules, and I will get to understanding like the progression and things like that. But coming out of your Masters of Public Health, did you have the thought that you would be an epidemiologist? Was that what you were like striving for? Like how did that kind of like fall into place?
So I'm certified as a health educator. It was not, I never envisioned that I would be an epidemiologist. That's not what I studied to be. My specialty was in community health. However, it is one of the things that I will say that if you're going into public health, the best thing that you can do is keep an open mind and be flexible and not be afraid of opportunity as it comes to you, because if the opportunity comes to you, there is some work that you need to do there, right? So although I carry the title of epidemiologist, I did a lot of strategic planning around how to meet the community where they are, and how to bridge the gap between lifestyle and diagnosis. And so I was doing the work that I was passionate about all along. So at the end of the day, the job title doesn't matter. Are you doing work that you have heart for? And I can honestly say with each program that I worked for with the health department, I had heart for the work, which led to me having creativity and passion that drove change in each of those areas.
I appreciate you sharing that. And I think that's important for people that might be coming out of their bachelor's program or their master's program. It's like you don't necessarily have to have everything figured out, but just knowing that you have the skill sets to go into these organizations and do this type of work is important. And then from there, you can build out your skill sets and build out your knowledge areas to really figure out where you want to make that impact in your career. So I appreciate you sharing that.
Yeah.
And the second question I wanted to ask around this is, so you were a couple different epidemiologist positions at the Department of Health, and then you became a director. What were the things you think you did for yourself to say that, hey, Quinyatta should be a director at the Office of Rural Health and Primary Care?
I think one of the things that I did is that for every program that I've named, I am able to identify something that I left behind. I was able to add value that truly moved the community forward, the target population, a way that helped them, that was sustainable. Also, I think the movement through multiple programs allows you to develop different skill sets. It also allows you to build different networks that lend to you being a successful director.
And I think it's during this time as well, you started your organization and became founder and CEO of Mumford and Associates. So tell us about that thought process and like, what did you all do when you just started this?
Okay, so one of the things that you've heard me say constantly is that my goal is to bridge the gap between diagnosis and lifestyle. In addition to colon cancer running in my being consistent in my family, I don't like to use the term running in my family because I don't think it's something that we have to own. But I also have family members that are living with diabetes. And I noticed the disconnect between diagnosis and adjusting so that you don't become defined by the diagnosis. And so I started the company with the intent of providing in-office health education and promotion services for physicians that served my target population, which were low income, vulnerable minorities, right? So that they would have an opportunity to really understand what their diagnosis means for them and to understand that that diagnosis doesn't have to become them.
Yeah, that makes a lot of sense, and I like also like that framing of not owning these diseases, like because they are things that happen to us, and if we consider what the goal is like how do we get to self-realization around health, and in getting to that we would understand that all the social factors that are causing many of these diseases don't exist. So it's not necessarily that we are owning the disease, but it's just the context in which we are in is affecting our lives to create these diseases or like make them more apparent. And what was that process like you, because this is like building out a business. How did you go about like marketing or like working with these physicians or these clinics?
So actually, a physician actually reached out to me, and so we just kind of worked through the contract around what made sense for her. And this was really a build the plane while it's flying. We were both learning and developing, so I feel like she took a chance on me by allowing me to come into her office and offer services. And as we started to see the impact that it was having on the patients, we continued to develop those relationships, and it just got better over time.
It's always good when someone's asking you to do something and then you're like, oh yeah, I can do that. I have the skill set to do that.
Yep,
Because
exactly.
I feel like many times people do it in the reverse. It's like they create something and then they go seek out people who want it, but it's always a better idea. And like, not to say you can't do it the other way, but it's always great when you have people that are asking you for something and then you're like, okay, let me create something to help and support them.
Yep, exactly.
And you've been the CEO of Mumford and Associates. I believe it's almost 60 years now. What has that progression as an organization looked like?
So one thing we've shifted from individual patient care to focusing more on community development, workforce development. We pivot based on the public health landscape. So right now, a lot of our focus is on the youth mental health crisis post-COVID, really understanding the needs of our young people and elevating their voice, teaching them how to advocate for themselves, but also teaching those that serve them how to represent when they may be in crisis and how to communicate with them in a way that's reflective of what they need. That takes the whole society realizing that young people are not the same young people that we were when we were growing up, because society is not the way that it was when we were growing up. That comes with some uniqueness that requires us to think about the way that we handle our young people a little bit differently. So my goal right now is really to help them elevate their voices so that they can be heard and understood.
I guess the question that stems off of this for me is I think a lot of us have been focusing a lot on youth mental health now during the pandemic because we've seen what that lack of interaction and what the pandemic has done for many youth who are at suffering at higher rates of mental health disease at this point in time. So was that how this program area or topic area kind of came out? Was it because of the pandemic, or did this happen prior to the pandemic?
It actually happened after the pandemic. So after the pandemic, I had a lot of organizations that were just struggling really to communicate with young people. So I started offering youth mental health first aid training to youth serving organizations. Within the first month of offering the training, I trained over 100 people in the US, Canada, and Japan. Because there was just an increased need for it. In this last year, we switched from focusing on adults to actually focusing on educating, engaging, and empowering young people. Because just like adults are looking for information, young people are looking for information. It's just like sex. If we don't provide our kids with the right information around sex, they share the wrong information with one another. So to combat that, I want to make sure that they have the right information to destigmatize mental health and feel comfortable with talking about it.
That's perfectly well said, and the conversation around mental health has evolved a lot in the last couple of years, as well as like couple decades, and so, and like just how important it is for us to focus on this and like create solutions to the mental health crisis. So Japan, how did that come up? Like USA and Canada, all right, that's cool, but that's kind of like traditional. But Japan, that's the other side of the world. How did that come up for you?
How did that come up for me? So there are organizations that are based in the U.S. that have individuals that are serving overseas that are still wanting to do work with young people. So that resonates with them, that they still need to have this knowledge base in order to better assist the young people that they serve. And so it just naturally evolved that the more people started talking about the work that I was doing in the US, they started sharing it with their peers overseas. And so our clientele increased over there as well.
That's really dope. And like shout out to you. Shout out to you for doing the work and like
Yes.
being effective in doing the work so much that people from next side of the world would reach out and say, hey, we need these resources as well. How can you help and support us? So definitely goes to show like the work that you're doing is very impactful and important. So I appreciate you doing that work and continuing to do that work.
Yes.
So before we go into your doctor of public health and everything that goes in with that, like how do you think getting your doctor of public health has helped or transformed the work that you do with Mumford and Associates?
I think getting my doctorate provides some validation in terms of, when people see, doctor, they are more receptive to the things that you have to say. And so I think that it adds value that I am committed to this craft. I'm committed to educating myself. I'm committed to the communities that I serve. And so that was the reasoning behind, kind of validating, who I am and the things that I say.
Okay, that makes sense. And I'll ask you one more question about Mumford and Son before we go on. So you've done a lot of extensive work. You've developed your organization. You have pivoted and shifted to the different needs that have come up throughout the time course of having the organization. What advice do you have for people out there that might be now starting up an organization and they're trying to make social impact? What advice do you have for them?
Don't box yourself in. Don't box yourself into one thing. You see with my career, I have touched varying programs, which has increased my knowledge base substantially. With my business, I pivot to meet the needs of the community. If you truly want to do social impact work, you have to have some level of fluidity. And so that's the most important thing that I will say to anyone that's wanting to do the work. Don't box yourself in. If you want to meet the needs of the community, let the community tell you what it needs.
Yeah, going back to that golden rule, you meet the community where they're at.
That's it.
Right. So you got your Doctor of Public Health at the University of Arkansas for Medical Sciences. Tell us about that thought process. You shared just now that you're really trying to ensure that you had like validation as an organization, as a leader in the organization, and the doctoral degree definitely helps. Were there any other thought processes or like decisions that really led you to wanting to pursue this Doctor of Public Health?
Yeah. So again, it was validation for the business. I wanted to make sure I knew that at some point I wanted to take my business to the next level. And I wanted to make sure that people were confident in who I was as a public health practitioner, but also I wanted to grow in public health leadership. I knew that I wanted to continue to elevate. If I stayed in state government or even federal government, I knew that I've done the programs, I've touched varying programs. So now, how can I have a greater impact from a leadership stance? And so, going and getting my doctorate was just the next step in growing as a leader.
Yeah, that makes sense. And like we'll talk about the leadership in your future roles, but I think like the importance of that in not only building out and supporting the validation and the work that your organization is doing, but allowing you to develop into a burgeoning professional and being an adjunct professor. And we'll talk more about the current roles that you have right now. But were there any like big takeaways that you have to share from your Doctor of Public Health experience?
Man, from the doctor, public health experience, tenacity. Woo! Goodness, it takes a lot of tenacity to get through the whole journey, whether it be, from getting ready for comps, that's a challenge in itself. When you are operating as a public health practitioner, you are really learning how to take the textbook information and apply it regardless of the environment that you're working in, right? But in an academic setting, you are expected to give back that textbook level of knowledge. And I struggled with that because I have been a practitioner for so long. And I'm like, I know that's what the textbooks say, but in reality, we didn't do all of that. Like we had to do some other things because time was of the essence. And so I had to, just like I have to meet the community where they are, I had to learn to put myself aside in order to get through the journey. Because at the end of the day, in a doctoral program, the end game is to graduate, right? And that means that sometimes you have to swallow your pride in what you think you know in order to meet the requirements that the program has of you.
Knowing the end goal and keeping your eye on that is so important, and not
Yes.
getting strayed away by different things
Oh, yeah.
is so important as well. And you spoke to wanting to get like the validation from the DrPH. Is that something, looking back on it now, that you've gotten and it's helped and supported not only you in your career but your business?
Yes. Oh, yes. I think that it's definitely added value to the business that when, I present myself, whether that be to funders or I present myself to partners, that they have a different level of trust, knowing that I am putting in the work in order to, stand true in my profession. So, yes, I definitely think that it adds value. I think that it has also opened up additional opportunities for me to grow as a public health leader.
What advice do you have for someone that might be thinking about getting a Doctor of Public Health?
If you're thinking about getting a doctorate of public health, number one, be clear cut about what it is that you want to focus on so that from day one, you can start developing your thoughts around your specific topic, right? You can start, each assignment should be building upon your dissertation so that when you get to that dissertation phase, you're not starting from scratch. You have a very strong understanding of your topic area.
Absolutely makes sense, and just makes life a lot easier for yourself. And I think like many of us understand that during your MPH program, you're able to tailor assignments and things to things that are of your interest. And I'd imagine it's a lot of the same in your DRPH program. And to your point, it's like, how are you taking those assignments and being intentional in understanding, okay, this is what I want to be an expert in, and then shaping your assignments so that you're just continually learning and building on those experiences so that you are a better expert. And as you said, you're not starting from zero when you're thinking about getting to the end of your program. So that definitely is appreciated. And I think just being intentional, I think going into a DRPH program, a PhD program without an idea of like what is your end goal or what are you trying to understand is something that can be very stressful. So I would definitely say that focus on knowing what you want to do before you go into the programs, and that would be so much better and so much helpful in your journey.
Yep. And then graduate first. You can save the world after you graduate.
Absolutely,
Yep.
absolutely. And as you were saying earlier, you became that doctor just a doctor in a different way,
Yeah,
but
just in a different
very
life.
very much still a doctor and making impacts on population health levels. So I appreciate that. So after you graduated, well, I should just say you're an adjunct professor currently. You you work for Southern Arkansas University as well as New York Institute of Technology. Tell us about the experience of being an adjunct professor.
Okay, so while the director of the Office of Rural Health and Primary Care, I got to build some great relationships with different entities in terms of bringing people to the table that typically don't have a seat, because we were able to expand our reach in terms of, smaller organizations that we can fund, which opened up an opportunity for me to foster relationships with individuals I may not have met. In turn, this led to me starting to adjunct at Southern Arkansas University in their undergrad MPH program. From there, I also, about a year later, I started adjuncting at NYIT, the New York Institute of Technology, in the School of Osteopathic Medicine, which is interesting because you said that, hey, you eventually became that doctor. This is where I realized in this interview that my story has come full circle, because as the program director for the MPH program at NYIT and an assistant professor there, I get to train doctors, right, that are interested in public health. And so that bridge between lifestyle and diagnosis, I get to contribute to it not only as a small business owner, but I also get to contribute to it through academia, which brings, my story to a complete circle, right? In my opinion. So I think it's amazing how things kind of flush out. You set out on a path like, I'm going to do this. You're going to have the influence because you have that passion and that vision. But the way that it flows, the way that it flushes out may not look the way that you originally envisioned, but it can still be beautiful nonetheless.
And going back to your point of like not boxing yourself in, just
Don't
being
box yourself
open to
in.
opportunities,
Yep.
because as you say, like we have no idea where the work that we do can take us, and there's so much work that can be done in public health. So never just appreciate all opportunities that you have and learn from them and take them forward and use that to shape where you go in your path.
Exactly.
And what advice do you have for people that are starting off becoming adjunct professors or professors just in generally? What advice would you have for them?
Be creative and keep the students first, right? One of the things that drives me as a professor is to always reflect upon what I was missing in academia, and I try to be that. So it's like be what you wish you had had. I like to share my experiences. I like to bring the textbook to life so the students can really understand or see themselves as a public health practitioner.
That is a lens that all professors, teachers out there should be taking, is like show up as the teacher that you really appreciated, as well as all the things that you didn't get that you wish you did get. Show up as that person, and
Show up as that.
you all right. So you were also the Chief Informatics Officer at the CDC Foundation. I think it was a contracted position. How did you come across this, and what did you do in it?
Actually, I left the state health department to go work with the CDC Foundation. As a public health informatics officer, I support the New Mexico Department of Health in their data modernization efforts, really helping them identify, how to modernize their data systems. This is where my experience in various programs comes to play, because I've had an opportunity to work in a lot of those systems to support a lot of those programs. So I have a broader understanding of the data needs, so I can understand it from the end user so that we can communicate with our IT professionals about the importance of what the end users need. So that's what I do in that particular role.
Okay. And I know you did a lot of work there with like data visualization. I think you use tools like Tableau and Power
Yes.
BI. Talk about how data visualization is important and contributes to better decision making in public health and healthcare.
So data visualization is important bidirectionally, right? So data visualization is important internally because it enables us to make data-driven decisions. So across programs, we can share information and entangle, information so that we can create a better understanding of where people live, work, play, learn, and worship, and how it's impacting their health, right? But on the flip side of that, data dashboards are also helpful for the community because it allows them the opportunity to play with the data and really understand how those same factors where they live, work, play, learn, and worship are impacting their health by comparing, different outcomes to where they live, like comparing county data to see, oh, well, this is more prevalent in my county than this county. And it piques their curiosity to get the general public to start asking more questions about what's happening around them, which in turn gets more people talking about public health and increasing our understanding about the relevance of public health and that public health is everywhere and it impacts all of us.
Love it, love it. And yeah, data visualization so important, and giving community the ability to see their data and understand their data and like just know how to look at it and say, okay, this is the trend, this is the comparison, this is where we are. What are the things that we can do to come together and be at the table to drive forward and improve those health outcomes?
So one of the things that I think is important to remember is that we see data as a thing, right? We see data as a thing. We say, see your data, see their data. Data is people, is representative of people. At the end of that, that's people. And I want people, when they look at data visualization, where do you fit in this picture? And where do you want to be in this picture?
And I think to dig a little bit deeper there, it's like, where do you fit in this picture and what is your story there? To like get both the quantitative but the
And the
qualitative,
qualitative,
which
you have to have that
right.
qualitative data really to understand what the numbers mean. And, you've asked me a number of times, like, what would I say to public health practitioners that are starting out? Go to where your data is. Get to know where your data comes from. Learn the communities, because those numbers will only tell you so much.
Absolutely. And you alluded to it. You are the MPH program director and an assistant professor at New York Institute of Technology. First of all, congratulations on the new
Thank
role that
you.
you have. You're
Thank
most
you.
welcome. So tell us about that role, how you came across it, and what do you do?
Okay, so the MPH program director, the NYIT MPH program is fully online, 100% online, which I love because I told you I started my MPH journey online. We focus on population health and really helping people understand what population health is and what that means. We do cater to our DO students. We want physicians that want to learn more about population health along their DO journey. We want to train them up so that they can make an impact in the communities where they serve. I also teach in the program. I teach program planning and evaluation, as well as some other classes such as systems thinking, really to add those lived experiences that I've had back to the classroom.
And I think it's important to have as many people as possible in healthcare space that know about public health and
Mm-hmm.
public health concept, public health framing, because I think too many times it is focused on like the sick care model and it doesn't really think about what is the population impact here and how can we really like get to root causes and address the social determinants of health and address like the community from a holistic perspective. So taking into consideration all of those things, what are like the main things that you're trying to get across to these DOs and other people that are going to be healthcare professionals?
That they can make a difference, right? That outside of just the patient to patient care, that they have the ability to take their role in order to really swing the pendulum on health disparities and to move us closer to health equity.
Absolutely, absolutely. Okay, so I guess I'm before I move you on to the Furious Five, I just wanted to ask if there was anything that I didn't ask that you think would be important for you to share along your journey.
One of the things that I don't think we share a lot, I mentioned this on the front end, that I am a mother, right? This is to the mothers. Don't count yourself out, right? You have a lot of value to add to public health. It does get hard, but it's doable, right? this is definitely a doable path. Especially, I want to see more minority women pursuing their DrPH.
Shout out to all the mothers out there. Okay, so before I move you on to the Furious Five, two questions that I'm going to combine into one. Where can people connect with you, and where would you like to see yourself in the future?
Man, so people can connect with me on LinkedIn, definitely on LinkedIn under Quinyatta Mumford. On Instagram, I am the Village Public Health Doc. Where do I see myself in 5 years? In 5 years, I envision myself fully engrossed in the Village Public Health Training Center, where I aim to increase the number of minority youth that are practicing or considering careers in public health.
We look forward to seeing where that journey takes you, and look forward to seeing that impact. And I think it is so important that we continue to have diverse voices in public health and people that are working towards communities that look like people in the communities. We also need the white and other people allies as well, but
Oh
I
yeah,
think it's just important to highlight that. So appreciate that work.
for sure. We definitely, want to be inclusive of all people because, again, we need public health practitioners that resemble the communities that they serve.
Absolutely. Okay, so moving you on to the last section of the show, the Furious Five.
Okay.
Questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Keep an open mind, right? Be nimble in the field. Be willing to challenge yourself to try new things, even if you think that it's not your jam. Give it a shot. If an opportunity presents itself, go for it.
Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Wanting to get into my position, I would say, make sure that you build up your skill sets, that you are investing in yourself, that when you recognize that there are new trainings on the horizon, don't wait for someone else to present it to you. Go for it. Make sure that you are constantly educating yourself, that you're inputting and connecting and building your network so that you can leverage opportunities as they become available.
Number three, what's something you are working on improving in your life right now?
The one thing that I'm working on improving in my life right now is balance, right? We've talked along the show about the number of roles that I play. I think that is important to me. Good health means having balance. I want to live a soft, peaceful life. And so, I try to maintain a level of balance and minimize chaos and confusion as much as possible. So that means identifying what's most important to me, and investing in that.
Love the soft and peaceful life.
Yep.
And that sounds beautiful. Number four, professionally, do you recommend anything?
Professionally, I recommend, TD Jakes has a new book out, and it is called Disruptive Thinking. I recommend that book to any public health practitioner because it has a lot of gems in it that will motivate you to really dig deep into your thought processes and why you move the way that you move, and to start to contemplate, are there some things that you need to change about the way that you're thinking?
And then last but not least, if there was one piece of advice you'd give to your younger self, what would that be?
Don't give up. No matter what people say you can't do, don't give up. Believe in yourself. I'm a true advocate that if you've been given vision, that the provision will come. And so sometimes you have to put your blinders on and not let what other people are saying detour you from the vision that you've been given, because your vision is not for everyone, right? And so don't get lost in what other people are doing. Don't get lost in what other people are saying. Stay focused and stay true to who you are and what you've been called to do.
Love it. Love it. Well, Thank you so much, Quinyatta, for coming on and sharing your insights and your story. I greatly, greatly appreciated it.
Oh, you're more than welcome. This was good.
Yeah. I enjoyed it a lot. So, housekeeping items, everyone. Be sure to subscribe, to leave a like, to leave a review, and share it with a friend. These are the ways to really get it out to more people. And I appreciate you all listening to this. So, subscribe if you haven't as yet, leave a review, and share it with a friend. Greatly, greatly appreciate you all. See you all next week.
All right. Bye.
Peace.